I remember one constellation that we did in Brazil, where a young girl of 16 or so with a lot of overweight came, and she was also emotionally very affected, always depressive, and had 2 suicide attempts and all that. So the question was, what is it? What is the tension behind that she is coping with? Because the mother is a caring mother and it's a normal life. But still something was expressed in her that it didn't make sense in her own life, so it must come from further away. So we were setting up the background, we were setting up the grandparents and the great-grandparents, and then it became clear we had the nation of the Indians, the South American Indians there, but also we had the slaves. And when we brought Africa in, which you could also see in her features, the whole constellation relaxed. Yeah. But it was not enough yet. So we were thinking, what is this beyond? On the mother's side we had the Inquisition, that was kind of an impact in that system. When we brought this one in, there was a relief. And it was still not enough. So we were thinking, what happened in Africa before? And we brought in the perpetrator for the slaves. So we brought in the slave trader. It was an Arab slave trader. And when we put this one in, again the whole system relaxed, the whole constellation relaxed, because it was another information that was externalized that everyone recognized and could exhale. And we looked at this slave trader, and he was smiling so friendly to the slaves, until we found out it was not out of humanity, but it was because of his business. And he had to take care very well of the slaves so they would bring more money. And so when we look at all these implications, and there is another layer, and there is another layer, so suddenly the extension of our understanding is getting much, much bigger. And this girl found herself suddenly, with all her ancestors in the past, with all this converging and diverging information in herself, and I think it made a lot of sense for her to understand better who she actually is now in this one body. So in this whole work of working with these difficult emotions and repressed emotions and all the states that we find in ourselves, after some time people came and asked me if I knew the work or if I had done a training with Peter Levine, and I didn't know him at that time. And they said, well, I'm working like the people who are working with somatic experiencing. So, and over the years now, in the last 10 years, somatic experiencing has become an essential part in the work of Constellation, because we deal with personal, biographic or systemic trauma that we inherit from our parents. We always say we inherit the nervous system of our parents. And every information that we have in our body is also an indication to what happened in the past. So we know it, or at least one part of our body knows it. So what I always like to explain to the participants is how we store this information in our body. And Peter Levine brought this wonderful descriptions that we are still mammals, that we still have the mammal experience in our body. When we come into a difficult situation, then there is adrenaline and all the neurotransmitter and all this information and hormones released. And this gives an impulse for a movement. And the animals, like the wild dogs or whoever, or the antelopes, they go into fight or flight. And by this physical movement, they release all the information and they use up the neurotransmitter information in the body. So this gestalt is being closed. Now, if fighting or fleeing is not guaranteeing survival because we are too small, it's too fast, and there's no alternative, and we can't stay present, then we have another option, and this is just to freeze. So when we come into a difficult situation, there is this arousal and this impulse, and then it stops here. So this means that the chemical information, the chemical essence of the information is not being used up, but it gets stuck in the cells and in the body and in the muscles. And this is where we go in therapy, in trauma therapy, but also in constellation. We look what happened in the past as a traumatic event where the person froze. And we try to close the gestalt. So we have to deal with the impulses that haven't been expressed. To deal mainly what we do, because we don't act out as Gestalt therapy where it was going acting out. Just what are the feelings that haven't been felt there? And these informations, now we know through epigenetics, they are being passed on through generations and generations, already from one generation to the next. So we can go through the information that we get from our clients directly to the traumatic events in the family system and look what was needed then. What is still needed in this body, actually it was needed in my mother's life, in my grandfather's life, in my great-grandfather's life, or still further back. Just to close this gestalt, and then the person gets the relief in their own body. And this means, as we are the essence of the system, it's also a change in the pattern of the whole system. So there's this relief going through all the ancestors' line.